In this video, we are going to talk about 5 benefits of US healthcare system. So, before starting the video, please like this video. Do subscribe and turn on the notification to our channel for future updates. The healthcare system in the United States is a complex network that is made up of a variety of institutions, including government organizations, hospitals, doctors' offices, research facilities, and health insurance firms. Although there are a lot of people who have issues with the way that the healthcare system is organized, it does provide a lot of advantages. One of the most advanced methods of medical research can be found in the United States. Because of the current free market system, medical researchers at institutions such as Harvard Medical School, the Mayo Clinic, and the Cleveland Clinic are gaining global recognition for the advancements they are making in the field. Some American insurance plans are among the greatest in the world, yet, in order to take use of them, one must either have a job that offers generous benefits or sufficient financial resources. Another advantage of the existing healthcare system in the United States is that taxpayers are not responsible for the costs that are connected with the provision of health insurance to each and every individual. The United States already has the highest healthcare costs of any country in the world, and a system in which all Americans are covered would only serve to inflate these costs more at the expense of taxpayers. There is a widespread concern that supporting a new healthcare system with tax money would divert resources away from other important areas, such as education and national defense. 5. Innovation. The medical treatment methods used in the United States are among the most innovative and advanced of any in the world. People from all over the world travel to the United States to receive some of the greatest medical care that can be found elsewhere. The United States of America came in top place for science and technology. Indeed, the gap between the United States and Denmark, which finished in second place, was by far the largest recorded in any dimension of the index. This contributed to the United States' overall position. The United States came in first place when it came to the number of new drugs and medical devices that received regulatory approval, first place by a significant margin when it came to the number of Nobel Prizes in chemistry or medicine awarded per capita, and second place when it came to the scientific impact, which was measured by the number of citations. Additionally, in terms of the amount of money spent on research and development per each citizen, the United States came in at number 4. This preeminence in scientific influence directly translates into medicines that are created by local pharmaceutical and biotechnology businesses, particularly in and around major metropolitan areas such as Boston and the San Francisco Bay Area. 4. Coverage for the most vulnerable. In spite of the fact that there are 50.7 million people in the United States who do not have health insurance, the federal government does offer insurance to those who may have the most difficulty providing for themselves. Medicare is a health insurance program that is managed by the federal government to cover senior persons and individuals who are disabled. People with low incomes are covered by the Medicaid program, which is run by the government. The Children's Health Insurance Program, sometimes known as CHIP, is a federally funded initiative that offers medical coverage to the nation's millions of uninsured children. In addition, the recently enacted Affordable Care Act makes it possible for children and young adults to remain covered by the health insurance plan of their parents or legal guardians until the age of 26. 3. Regulations regarding safety. It is the responsibility of various government agencies, including the Food and Drug Administration, the Agency for Healthcare Research and Quality, and the National Institutes of Health, among others, to ensure that patients receive safe, effective, and high-quality medical care and medication. If the FDA determines that a drug is hazardous, the agency has the authority to remove it from store shelves. The National Institutes of Health, NIH, maintains rigorous criteria for the quality of biomedical research. It is the goal of the Agency for Healthcare Research and Quality, AHRQ, to enhance the level of quality, safety, efficiency, and effectiveness of health care provided to all Americans. 2. Patient privacy. The United States healthcare system places a premium on protecting the confidentiality of its patients. HIPAA, which stands for the Health Insurance Portability and Accountability Act of 1996, was passed into law in order to protect the privacy of patients. Citizens of the United States can rest assured that the confidentiality of their medical records will be maintained. 1. Treatment in an emergency. Even though the lack of health insurance in our country is still a major problem, emergency rooms are not allowed to refuse treatment to anyone simply because they do not have health coverage. When they have nowhere else to go for medical attention, a lot of people end up seeking it out at emergency rooms. Although this is not a solution to the insurance catastrophe facing our country, it does provide some comfort and the hope of receiving care for those who do not have coverage. So, that's it for today's video. What are your thoughts on our video? Please let us know in the comments section below. If you enjoyed this video and want to hear from me again, be sure to hit that subscribe button and turn on the notification to our channel before you go. Thank you so much for watching.